What are my chances? Will I get better? Many people want to know their chances of recovery before they fully understand their blood cancer diagnosis. Patients often expect a yes or a no answer, but it's not that simple. To answer this, we consider many factors including the patient's age, existing health issues, whether organs are affected, and the presence of any resistant infection. Conditions at diagnosis are crucial as intensive treatments like chemotherapy might not be feasible due to potential complications. Acute myeloid leukemia is still a difficult disease to treat. Now, if you look at this image, it shows survival data based on outcomes. This data is from the US over the last 19 years. On the y-axis, you see the person surviving. 100% means everybody is alive, and 50% means only half are alive. You can see that the outcome varies greatly depending on the age at which you develop acute leukemia. The younger you are, the better the outcomes overall. So overall, if you look at the 5-year survival rate, it is between 20 to 30%, which is not a lot. We also examine the specific type of disease, assess the risk level based on genetic information, estimate the likelihood of disease responding to treatment, as well as the probability of its recurrence or relapse. How does this assessment work? To understand this, take some time to examine this image. Although I won't detail all the tests necessary to gather this information, it's important to understand that the results allow us to categorize conditions like AML into favorable, intermediate, or adverse risk categories. Favorable indicates a reasonable likelihood of treatment response, and these patients don't immediately need a bone marrow transplant. Intermediate or adverse categories, however, suggest less favorable response rates and outcomes. Besides chemotherapy, these patients require a bone marrow transplant to solidify any response achieved through chemotherapy. This does not guarantee a cure for every patient classified under the favorable category. It simply indicates they have a higher chance of successful treatment compared to those in the adverse categories. The diagnosis and risk categorization of acute leukemia are ahead of treatment. This means that the information generated through specialized tests has helped us understand the mutational landscape of leukemia, including which mutations can cause worse outcomes or a good chance of cure. Take a look at this pie chart to see the mutations detected in acute myeloid leukemia to understand what I'm referring to. However, we haven't yet designed drugs that specifically target most of these mutations. In the last 50 years, we made steady progress in treating acute lymphoblastic leukemia. We can see this in a study of 2852 children who were newly diagnosed with ALL. Now, nearly 90% children survived this disease. But like AML, the older you are when you get diagnosed, the lower your chances of survival. Patients generally receive similar treatment protocols, but their responses can vary greatly. We often give the example of 4 brothers growing up in the same household, having access to the same education, upbringing, and resources, and yet they almost never become equally successful or have the same careers. Likewise, we can't be certain about how a patient will respond until we reassess their disease status after the first month of treatment. Patients who don't respond to treatment get more chemotherapy. Sadly, they usually don't do well over time. The term cure is somewhat arbitrary. We cannot declare a patient cured until probably 5 years after completing treatment. A small number of patients may still experience a recurrence of the disease even after a longer follow-up. Other factors, though not directly related to the disease itself, can affect outcomes. These include the patient's adherence to treatment and their social and financial support network. We are making progress towards finding a cure with each day that passes. Finding answers to our existential questions is a process that requires time. The treatment protocols are extensive and patience is crucial. It's important to approach this journey one step at a time, one day at a time. Remember to persist with necessary treatments and not to miss any doctor's appointments.